Hi, good afternoon, everyone. This is Kathy Storr at Illinois Action for Children. Thanks so much for taking some time today to be on this webinar. As you all remember, the BUILD initiative put together a fabulous report for Illinois on the community systems initiatives in 12 states around the country. And as a thought leadership group, we asked for the opportunity to go a little deeper into some of those states. And so BUILD has assembled a panel of leaders from Arizona, Oklahoma, and Virginia to talk with us today. And I will just tell you in the call before the call, I'm so excited to have them engaged in this conversation with us today because I think that we're going to find a lot of similarities between what they've experienced and what we're experiencing. And so I'm looking forward to the ideas and the conversation that they'll spark. So with that, I'm going to turn it over to Jerry Cobb with BUILD to introduce our panelists today.
Great, thanks, Kathy. And I just echo, your remarks. We've already had a good time just thinking among ourselves about our own wish list and lessons learned. So this is a great conversation, and I'm so happy to be talking with all of you. I am the State Services Director for the BUILD Initiative, and BUILD is coordinating a team to work with Illinois in their community systems development process. Before I go much further, just I'll ask everybody, you might want to just go ahead and mute your phones to make sure there's not extra noise in case somebody pops into your office. And you can either press the mute button on your phone or you can press *6 to mute your phones and *7 to unmute. And I'll put that in the chat box as well. And I can't talk and type at the same time. We want to make this conversation as interactive as possible. This phone call has been scheduled for Illinois, so this is your opportunity to talk to people, to get your questions answered, to share your concerns or comments, and so make this as useful for Illinois as you possibly can. We are doing a national webinar on the national research that we did, and that'll be March 17th, but that'll be, a crowd of hundreds. So this is specifically for Illinois and your opportunity, so I hope everybody will take advantage of it. As we go through, I'll ask each of our speakers to give an overview of the structure and the work in their state. And then we'll go into questions from there. And I've got a list of questions to ask them, but if you've got questions, your questions are most important, and so feel free to either interject during the conversation or raise your hand on the computer and I'll call on you. Or else put a question in the chat box and I'll keep an eye on the chat box and interject those questions as we move ahead. So do whatever works for you and fits your particular technology. I also sent you, and sometimes people don't notice this, in the reminder email that went out yesterday and today, you got copies of the national research that's been done, both the larger paper and then the executive summary that was tailored specifically for Illinois. We also sent profiles on each of the 3 states that are going to be speaking today, Illinois, Arizona, and Oklahoma, Arizona, and Virginia. And so you probably haven't had time to read those, but that'll be good backup information that you can refer to later on as well. So I hope you'll find those useful. To share the people who are going to be speaking with us today, they are some of my favorite people and some of my favorite states in terms of the great work they're doing. We have Kathy Glaser, who's Executive Director of the Virginia Early Childhood Foundation. Kathy helped create the Virginia Early Childhood Foundation when she was working for former Governor Warner and former Governor Kane in Virginia, and left for a while and is now back as the Executive Director, and Virginia is thrilled to have her, as are we. and Jackie Hale, who is the Director of Smart Beginnings for Greater Richmond, Virginia. Smart Beginnings is Virginia's early childhood initiative, and Jackie coordinates the work at the local level in the Richmond area. We also have on the phone Deborah Anderson with Smart Start Oklahoma. She's the director of Smart Start Oklahoma and the Oklahoma Partnership for School Readiness. Deborah is the second executive director at Smart Start Oklahoma, but was one of the founding board members as well. So she also brings both that early days perspective and the current perspective as well. And she has with her Megan Tyler, who is the community mobilization director for Smart Start Oklahoma, and and works directly with their local community initiatives and can share some of the work that she's doing. We also have Nadine Basha from Arizona. Nadine conceived the idea of a ballot initiative that eventually won a campaign in Arizona and is now funding First Things First, which is Arizona's statewide state and community early childhood initiative. Nadine, organized the campaign, raised the funds for it, and then when the legislature tried to take the money back, organized another campaign to make sure they didn't take those funds. And she'll talk more about that as well. She went on to become the first board chair of First Things First State Board, and can share that experience as well. So we've got a good cross-section of speakers today. As some of you heard who joined in early, we're already sharing our own lessons learned and what we wish we hadn't knew then that we know now. And this is Illinois' opportunity to take what we wish we could have done differently and do it right the first time in your own state. So it's a great opportunity, and I just thank everybody for being on this call and for these wonderful experts for sharing their own experience. So I'll start by asking Virginia to start us off and share the work in Virginia for just a few minutes.
Sure, glad to do it, and thanks for the opportunity. It's great to have a chance to talk with you all today. Just to give you a sense, the creation of the initiative in Virginia was really the brainchild of a group of business executives who got together to try to provide some recommendations about the state's early childhood agenda for the governor back in 2005. And their strategic vision and ideas led to the creation of the Virginia Early Childhood Foundation and implementation of the statewide public-private state-to-local system that we call Smart Beginnings. And it works all of us work together to provide a consistent vision and attention to the early childhood agenda in Virginia. One of the premises for all of our work is this odd, Virginia-only rule where our governor is limited to one consecutive term. So the only state in the country that limits their term so severely, and so the foundation was really created to serve as a private partner that could keep a focused agenda to promote early childhood even through what we call the revolving door of our administration. And so these, our business-led board maintains consistently that the strong workforce in our state begins with Smart Beginnings in the earliest years. And in fact, they've really driven an agenda where our state Chamber of Commerce this year has included early childhood development in their economic competitiveness plan. Since 2006, when this all began, the foundation has provided funding and technical assistance for the startup of 29 local Smart Beginnings initiatives, which all told cover about 90% of the population of our state. And so when each local initiative applies for funding, it has determined its own makeup or footprint. Multi-jurisdiction structure is encouraged, and then each initiative receives a multiple-year trajectory of funding and technical assistance from the foundation. And in this way, we establish local early childhood systems, and this generally covers prenatal to elementary age. Since we've gotten started, the foundation has awarded about 90 grants to local communities, and these have ranged anywhere from about $30,000 to $500,000 each, with the total amount of grants awarded since 2006 just over $11 million, and that's of January of this year. The state level entity or the foundation provides the funding and the technical assistance and the framework. And initially we had a very traditional grantor, grantee kind of a structure with program officers. And then a couple of years ago, we really reflected on the sustainability and the effect of the model that we've created and made some shifts in the response to what we learned with our sort of self-reflection. We really learned that systems building is dynamic and it's an ongoing journey. So whereas we had created this model that sort of led to the assumption that a system would be built and you were sort of arrived at your destination, we understand that the local system needs to be able to flex and adapt to different changes and conditions that happen in communities. And so we realized that we need to give more consistent attention and resources to support strong local systems. Second, we've really realized that systems building is not one size fits all. There's a great deal of diversity across our communities in this state. I'm sure you find that in your states as well. And we need to be able to adapt the model to make it most effective for each of the local systems. And then also, in order to maintain and sustain the benefits of this statewide enterprise, we have found that our local partners, the Smart Beginnings, really need to be able to see the value in staying connected with the state level hub. And so I would just encourage you to learn from our, some of the mistakes or the learning curve that we have, and that you really need to think long term about the exchange that you want to have, as a permanent kind of give and take and conversation between the state and the local level. Having learned these things, we've moved to more of what we call a franchise model, with the foundation serving sort of as the hub or the home office, and we try to provide the resources and targeted expertise. We try to really sponsor and conduct research and guide state-level policy and bring expertise in that realm, and then also provide a structure for peer learning at the local level. And we recognize that once the Smart Beginnings move out of sort of the funding trajectory that we offer, that we really need to make sure that they still see value in staying part of this statewide network. I think I'll leave it there, Jerry, unless you have other questions at this point.
No, that's great. Thanks, Kathy.
Sure.
Jackie, do you want to share what Smart Beginnings looks like at the local level, or what your particular structure looks like?
Certainly. And I love, Kathy, the introduction of the franchise model, because if that's the case, then Smart Beginnings Greater Richmond has over 1 million served. Our coalition, Smart Beginnings Greater Richmond, covers 10 separate jurisdictions, so 7 counties and 3 cities are within our regional footprint, regional or local footprint, about a population of 1.1 million in the Richmond MSA. We have urban, suburban, and rural localities in our footprint, so we have a very wide mixture of populations and capacity that we're working with in the various levels in each of those counties and cities. We've been around in some way, shape, or form since the late 90s. Our Richmond area, our Greater Richmond Chamber, had funding in the late 90s and began a Youth Matters coalition, kind of looking at some different ideas like a fatherhood focus, youth reading, early childhood, and found that some of the messaging that really connected with the business leaders was early childhood as workforce development. And I know Kathy was a player in some of those early meetings as well, because Richmond is also our state capital, so we kind of share a home base with VECF. Around that same time, in the early 2000s, United Way of Greater Richmond and Petersburg had a Success by 6 initiative. So they had some federal funding doing Medicaid screening, some early reading first kind of opportunities, and started building capacity at the local level with nonprofit providers, with the child care community, churches, health departments, so really kind of building that grassroots component. The Richmond area is not a big town. Even though we do cover a big space, it seems like a small town sometimes. So if you've got the Greater Richmond Chamber talking about early childhood with business leaders, and the United Way doing work with early childhood providers, you eventually end up in the same room pretty soon. So we began working together and officially merged under the umbrella of Smart Beginnings Greater Richmond. So when VECF became established and had that round of funding for Smart Beginnings Greater Richmond, we merged the work of the Chamber, the work of the United Way under Smart Beginnings Greater Richmond in 2007. And so we've been moving in that direction ever since. Around that same time, we worked with all of our local partners, schools, health departments, DSS libraries, to create a regional plan for children's school readiness. One of the things I think is a great point out of that is, in the late 90s and early 2000s, we had initiatives with specific grants and specific grant projects and deliverables, which were looking at early literacy, looking at healthcare, looking at professional development. So that was a good time for us to build trust among all the different partners that were around the table, because we had grant deliverables to work on together.
Yeah, hold on.
But what really benefited us as a collaborative was in 2007 through 2010 when we wrote and then published our regional plan for children's school readiness, which took a very high-level systems approach at how can we address this issue more than just providing books at a child care provider, more than just quality rating system, but really looking at all the different indicators and different areas and competencies of school readiness. So I think that's definitely something that has benefited our local collaborative, is to have that overarching goal beyond individual grant objectives. So that's been a good spaghetti test for us. If we have a new idea or project or partner, does it fit within our regional plan? We throw it up against the wall, and if it sticks, then it's a good match. As far as structure, so you've heard me say United Way and the Chamber were integral partners in this, and they still are. Our local collaborative is an unincorporated coalition. We are not a 501c3. We operate under the United Way's 501c3. So we are basically, we have staffing. I am a staff person of the United Way, but my work is 100% focused on directing Smart Beginnings Greater Richmond. So that's a good share of opportunities there. The Chamber, they help support us in our advocacy work as well. So we are not a separate 501c3. We are a collaborative, a coalition that exists in the community and helps keep all of the different providers pointed in the same direction, and our ultimate goal that all children 0 to 5 will be healthy, well cared for, and ready to succeed in school and life.
Jackie, when did you join Smart Beginnings as part of the statewide network that was created? Like, were you right there right from the beginning?
We were, yes. Mm-hmm.
All right. Is there? I keep hearing background noise.
I'm sorry. I'm in a webinar, so I'm trying to keep things along. Multitasking is not my best suit. But anyway, so you're heading to Erickson? Okay, good enough.
Okay. I think I've identified the problem, and I'm muting it. Okay, that should take care of it. All right. Now moving on to Oklahoma. Deborah Anderson and Megan Tyler, would you share the work in Oklahoma?
Jerry, it's Teresa. Are we going to wait until the end to ask any questions?
Ideally, but if you've got something you want to interject about what you've just heard from them right now, then feel free to jump in with a question.
Well, just for clarification, because were the money that was provided to the local level, was that conceived of as really just startup money and then it won't be an ongoing thing, or are you planning to have ongoing grants to local communities?
So what, the original idea would be that to have sort of this span of grants that would last, ultimately they got to where it was sort of a 6 to 8 year kind of phase in of building a system. So we recognized that initially communities needed to come together and plan and have a needs assessment, bring a leadership group together, and then sort of midway through they were ready for a large amount of funding to really scale up. And then we, again, this is sort of the original idea, would taper off so that they could sort of build their diverse funding base locally and be more self-sustaining once the grant trajectory was over. But what we've learned is that's sort of an idealistic view of how a local system is built. and we really recognize, I mean, Jackie described Smart Beginnings Greater Richmond, which has been really one of the stars in our constellation, but we realize that even as an initiative that's as strong as hers is and has that backbone organization of the United Way for sort of continued stability, there are just changes in leadership and in demographics and in the economy that happen at the local level that really have brought us to realize that we really shouldn't move away from this idea of consistently providing resources. We find that really making sure that there's enough funding for the local community to have paid, dedicated, expert staffing for the collaborative model is probably going to be, the most important thing for us to try to fund on a consistent level.
Thank you.
One more follow-on question, and because just you remind me of it, Teresa. Listening to Jackie talk about how many counties and cities she covers, and you had expressed concern at one point about how big is too big so that it's not local anymore. Jackie, do you have an opinion about that? You cover a pretty large area. Is it too big, or do you feel like it's owned by the community and it's still seen as a community effort versus a much larger effort?
It is a big area. It matches our United Way footprint and our Greater Richmond Chamber footprint. So when we began this, there was already a little bit of kind of an association of that region as the Richmond region. So there was already like kind of an understanding of that as a community. From an engagement standpoint, I will say we have some localities, those that are more central to the city of Richmond, are very engaged. It is harder for our rural partners to be as engaged for many different reasons. One of them is simply geography. They can't get to all the meetings all the time. We do try and rotate our various opportunities where we do meet face-to-face to encourage that engagement. One of the ways that we have kind of broached this angle is two things. We encouraged localities to come to us. Part of our regional plan was enabling localities to take our regional plan and create a local planning group that could specifically address, for instance, Charles City County, some of the issues they have using our regional framework, and then us working with them individually to kind of help them go through that process. So we do make a concerted effort to engage each locality as an individual. And then also keeping in mind our systems change role. There are some things that do make sense across this broad expanse of localities. One of those is kindergarten registration. In 2010 and 2011, we worked with our school districts, all 10 of them, to identify a single date for kindergarten registration. And once they did that across every school division, it was a duh moment. They're like, why haven't we done this sooner? So once they identified a single date, we and our regional coalition was able to secure private sponsorships and do a huge public awareness campaign, different and bigger than any of the single school divisions could have done on their own. So it's a mixture of two things. One, working to specifically engage those localities that are ready to be engaged and think at different levels. And two, finding the commonalities, because there are some, especially from a systems level, that will engage a broad array of the divisions that you serve.
Great, thank you. Mm-hmm. If there aren't any immediate questions, I'll go ahead and move on to Oklahoma now. So Deborah, I'll turn it over to you.
Okay, thank you very much. This is Deborah Anderson, and I'll also let Megan introduce herself.
Hi, Megan Tyler.
And we so enjoyed the great ideas we got from Virginia, so I hope we can build upon this just a little bit. I'm going to give you just kind of a brief historical perspective about how we formed. In the late 1990s, there was so much momentum going on in Oklahoma around early childhood. We were implementing almost simultaneously, at least it feels like it now, universal pre-K, essentially universal quality rating and improvement system, and universal home visiting programs implementing the nurse-family partnership. So we had some really broad initiatives that were kind of cutting edge at the time, and because there was so much going on, people stopped and said, wow, we need to figure out how to coordinate all of this. We need to figure out how to make sure that we've got families with the right kinds of access into the right kinds of services, and that programs are working together and families know what's available. And so there were other things going on in the country, and particularly North Carolina had some really great partnerships that they had been forming. And so Oklahoma learned from the information and the experiences that were occurring in North Carolina, and ultimately established a piece of legislation, initially had a task force and then established a piece of legislation to create the Oklahoma Partnership for School Readiness Act. And that was passed in 2003, so last year we celebrated our 10 years of being in existence. Over that time, we gradually, but relatively quickly, secured a $2 million a year funding that was a line item appropriation through our legislature, so it was specifically directed to the Oklahoma Partnership for School Readiness. We branded ourselves as Smart Start Oklahoma. In our legislation included the establishment of a foundation that was formed for the purposes of being able to accept private or other funding, federal funding or other state dollars could also run through the foundation. Our appropriation does not run through the foundation, and I'll talk about that in a minute. And so in a few short years, we organized a state board that is now a 32-member public-private board, and about 15, 16 communities came on board within the first few years of operation. We now have 19 communities. Your profile as of last Thursday became out of date because our board just added a new community who had applied, and we developed a memorandum of understanding between our board and this new community that's in far northwestern Oklahoma, where we had quite a gap in a presence in that part of the state. So we have the state board, the 19 local communities, 18 of which we have a financial relationship with, and the newest one we merely have an agreement that they can use the Smart Start name and will begin receiving some technical assistance and coordination with us through our office. So in the last 10 years, we've been relatively busy. I started about 3.5 years ago, and my third day on the job, I hadn't even really been in my office yet because I was going through we're university employees, and I was in new employee orientation. I hadn't even been to the office yet, and I had to go to the legislature, and the House fiscal staff wanted to know, well, okay, you've been around for a while now, so what do you have to show for your work? And I took a deep breath and said, I don't know, I'm here. I've only been here 3 days, and so let me work on that, and I'll get back with you. And I'll tell you that day 3 meeting, where it was pretty obvious we were going to have to begin to show some of our value and how we add value to the state and to the early childhood system, stays with me every day, because everything that we do needs to be guided around that so that it's very clear, not only to the early childhood stakeholders who truly believe that this is an important thing that we do, but to our funders, to our policymakers, to our state agency heads, and to our families especially, that we are here for the purpose of making sure that children enter school prepared and ready to learn, and that everything we do needs to be able to demonstrate, document, and articulate how we're helping make that happen. That has not been an easy task. We have done a lot of soul searching. 3 years ago, our 18 local communities were expected to have a coalition of early childhood stakeholders in their communities, conduct a local needs assessment to look at needs and gaps, and to write a strategic plan. And they updated that plan annually. And we were doing a lot of needs assessments and a lot of strategic planning and not too much on implementation. So in the past year, we've been pretty focused on bringing in training and bringing in supports and bringing in mentoring and coaching, and this wasn't just a one-time training that we sent people to, but we brought in Dr. Penny Foster-Fishman and Erin Watson to train us on the Able Change framework, and that has been a transformation process, I think, for us in terms of beginning to understand how to do a better job of developing local community change by gathering together stakeholders. And again, families need and should be a key part of that. So I think in closing, from that brief overview, we do have relatively stable state-appropriated funding, although that's at risk from year to year. We continue to have to prove our worth. We have private funding that we raise both at the state level and that our local community initiatives raise. We have a relatively close relationship with our local community initiatives, but they are not employees of ours. They're all independent contractors. So we have sort of this interesting dynamic between providing technical assistance and monitoring, and we're so short-staffed that usually is rolled up in one person, and that's Megan. So that has some challenges, and we could answer questions about that later. But we really have some folks who've been around for a while and some new staff who are really committed to now thinking about how do we really move the needle. It's much more, the relationships that we've formed among early childhood stakeholders have been great, but now we want to put those relationships to work and really unpeel those layers in our communities and try to figure out what are some of the issues that we as communities need to think about to get our kids prepared for school.
Thanks, Deborah. Anybody have any quick questions before we move to Arizona? All right, hearing none, I will now turn it over to Nadine Basha from First Things First in Arizona. Thanks, Nadine.
Oh, thanks so much for having me. I'm really happy to be here, and also just to hear everybody else's story. We all have approached this somewhat differently and yet have similar concerns, I think, and it's great to be able to share that. And I'm also very happy to share a different, maybe Arizona experience than what you've been hearing on the news, and maybe we can put a little more positive spin on who we are. As Jerry said, we were formed by a ballot initiative, which is, I think, one of the more unique ways of establishing system building in our country. Not all states have this mechanism, but in Arizona it's a mechanism that is used as a fairly effective tool for citizens' voices to be heard. So you can see that from the very beginning we've been a bit of a bottom-up driven model, a very locally driven model right from the get-go. And it really came about, some of the comments that you've heard, really about how do we sustain this when we have so much flux. You've heard us talking already about the change in governors, the change in legislature, the change in business. In our area, our business community turns over quite a bit. So you might have a champion one year and then you lose that champion another year. We've had, in our history, Success by Six, preschool at risk that doesn't exist anymore, full day K that doesn't exist anymore. We've worked with community foundations. So we have a long history of working towards something, but sometimes to no avail because our work, we have to take a step back. So our thought was to do a ballot initiative that put early childhood and funding for early childhood into statute. So when the law was passed in 2006, it actually did three things. It created the funding stream by taxing tobacco. It created a governance model, and it created a delivery system for early health and education, and it all predicated on a clear vision that all of Arizona's children are healthy and ready to be successful. So we're a bit of a hybrid organization. We're not a pure state agency, and we're not an independent organization, and it is also what we call a shared governance model. Our shared governance model is comprised, first of all, of a state board, and it's made up of 9 members. These members are appointed by the governor and confirmed by the legislature. And I will tell you, this is a point where there is the most control over first things first, which is part of our bane and part of our joy, because the legislature cannot dictate what happens with this money, nor can they change policy around this money as they do in public education continually. They cannot do that, and it's driven not so much based on politics as just trying to do what is best practice and best public policy. However, there's a lot of resentment from the legislature because of that. So it's a dual-edged sword for us. But the board needs to, by statute, have a balance of Republicans and Democrats and representation from the rural area as well as the urban area. Many times in our state, the rural area feels that they don't have a voice in terms of what happens in governance. We have on the state board 3 ex officio non-voting members. Those represent other state agencies, Department of Education, our Department of Economic Security, which is where our child care subsidies live, Department of Health Services, where child care licensing is. And the idea is to have dialogue with these agencies, to share ideas, to see where we can build on existing programs and how we can enhance coordination. The other part of our governance model is we have 21 local regional councils. And each council is comprised of 11 members. This is pretty specific about who we wanted represented on these regional councils. 8 of those positions are filled in the following way. There is a parent who is a child 5 or younger. There is a child care provider, an early education provider, somebody from the health community, a school administrator, someone from the faith-based community, a business representative, and philanthropy. Those are all represented. We have 3 seats who are at large, and there's no specific position that has to be filled, except if a tribal nation is part of that region, and then they have to have one of those seats. We have 21 tribes in the state of Arizona, and we allow the tribes, because they are sovereign nations, to either opt into a region or to set up their own regional council. Half of them chose to set up their own regional council. The others are engaged in the regions where they reside. These 28 regional councils were determined by the board when we first were passed into statute. The board was appointed, and then once the board was appointed, we had hearings all across the state. We looked at other kinds of organizations, how the state was naturally organized, and we came up at that time with 31 regional councils, but we put into the statute that we would have to revisit this every 2 years based on the fact that, populations change. We didn't want things to be set into law and have no flexibility in terms of making this work. We frankly did not know how it would work to have as many regional councils as we did. But we do review these boundaries, and on our first 2 assessments of this, we did not change them. This time around, we did. We reduced from 31 to 28 regional councils. And when we do something like this, we really try to have a great deal of engagement. Many of the things that we do at First Things First is we have people who are not a part of any of these board structures or providers, but people who are interested, who are outside of this immediate community, who participate. We had 2 people chair this, who headed up different foundations in our community. And then on that task force were providers, parents, regional council members, board members, and we all have a dialogue about what would make the most sense. And it is controversial, you can imagine, to merge councils together after you've set this in precedence. And finally, I'll just touch base a little bit on our funding. We've generated since 2006, about $630 million that has gone out into communities across the state. It's about $130 million from the tobacco tax annually. I think the thing that makes us fairly unique is we do have more funding flexibility in our plan here in Arizona, because we do reside outside of kind of that government model to an extent. We do have some things that we have to do within it, which also leads to complexity. But the money that is allocated out to the regional partnership councils, it's not on a kind of competitive basis, but it flows to each council based on the number of children they have in that region, 0 through 5, and then there's special weight for kids in poverty. And so each one of the councils has a different dollar amount that they have, and some of them can be very small, and some of them can be very large, obviously, and that sometimes is a challenge as well. 9% of the money that we generate goes for statewide initiatives such as our Quality First, which is our quality improvement and rating system, and then we have another 10% that is a cap. No more can be spent than 10% on administration. We do 3-year funding cycles. We set it up so that First Things First can receive grants, federal grants, private grants, and we are looking at how we can generate additional money through public-private partnerships because, of course, tobacco is a declining source of revenue. We do a lot of projections. We just had a meeting. We've done a 15-year projection of where we are and where we're going to need to be. So with that, I know Jerry has a lot of other questions for us.
Thanks, Nadine. I appreciate it. Before we move on to just general questions for the group, does anybody have any specific questions for Nadine about Arizona? People are probably still gasping from the idea of that much money all at once.
I know, really. We still are, too.
We've given you 2 different extremes in terms of funding.
However, I do want to tell you that's about $225 a child.
Yeah. And particularly in a state where they have cut so many other funding streams for early childhood. So when you put it like that, it's just a difference. It's all flexible money versus more restricted money.
Right. We've cut about $350 million out of our state budget in terms of programs and services for children.
All right. So moving on, some of these questions are generated from what we heard from those who registered, but particularly for Virginia and Oklahoma, you guys, like Illinois's got a number of local collaboratives already. When you created your system in Oklahoma and Virginia, you already had some existing ones, and then you created new ones. But what was the reason in creating Smart Beginnings and Smart Start Oklahoma for why your state thought it was important to take that local approach, and then also to create a state-level infrastructure to support that network?
You want to go, Deborah?
Okay, I'll go ahead. The community emphasis was pretty strong in our legislation that created our organization. And so right from the beginning, there was an awareness of the importance of engaging communities that if we're really going to impact change in the state, we have to get communities engaged around this effort, that it wasn't going to cut it just for state organizations to develop programs, but communities really needed to focus on the coordination and the implementation of those programs. So it was really one of our very early founding guiding principles that it was important to have that community piece. I think also, as I look at the legislation, I think there was an intent that the community and the state level body would work in concert with each other. And I will say that that is sometimes a challenge, and it's not that they don't get along, it's just trying to figure out how to translate the work that's happening in the communities to the state level in a way that the state board can be supportive and that we really have that collaborative relationship. And I think that that's a goal for us over the next year. It's hard enough to get the state groups to work together collaboratively and the community groups to work collaboratively, but then we need state and local to be working collaboratively as well if we're really going to move forward in the state. But that was just really one of our guiding principles from the beginning, that we valued that that's where true change happens.
And I would say similarly in Virginia, it was sort of a, the concept from the start was that, sort of the state to local with both the state hub and the local communities and partnerships being sort of equal partners in some of the purposes. So, our overall goal, everybody sort of agrees on the goal that what we want to do is advance school readiness. And school readiness services, children live in communities, and the rubber hits the road locally. From the federal perspective, Virginia is a state that's state supervised and locally administered, and our climate is very much sort of an affinity for local control. So it's really been important for us to have sort of the boots on the ground through the practical application of Smart Beginnings in our local communities that informs and connects back to state-level policy. So the foundation is sort of at this pivot point of being able to hear from and understand very intensively what is happening in communities across the state, what the needs are, what the policy change that's needed, and then being able to inform state-level action and policy. And that puts us in a really unique position of sort of being the pivot point in this two-way communication. At the same time, if you think about, as we work, and Deborah, you said earlier, and I totally agree, it's sort of this year-by-year fight to make sure we keep the state funds. And so to maintain that and to, cultivate additional public and private investment and support, having a really broad-based, diverse support at the local level is really critical. Our policymakers want to hear from their local constituents, and when they can really see the difference that Smart Beginnings is making in their own backyard, they're really encouraged and believe that it's a valid and worthwhile investment. So for advocacy and resource development purposes, that sort of combination of the state and local partnership is really essential.
So your legislators are hearing from your local Smart Beginnings initiatives, and they're engaged in advocacy?
Yes, and I'm sure Jackie can share a little bit more, but we have, especially in communities where there are appropriators, folks who are on the money committees, we've really generated a very sophisticated way of making sure that those communities are in touch with their legislators and, bringing the message that, we have to count on our state legislators to continue to support this initiative that really, is in touch with and supporting the community capacity.
And this is Jackie. And I think for the different Smart Beginnings coalitions throughout the state, they are at varying levels of activity with their advocacy. Our coalition has been very active, again, with our chamber partnership since the beginning. That was one of our key tenets, was communications and advocacy. So we have been able to really partner and support VECF when it comes down to look at their appropriation for funding. But another benefit of the state to local, the flexibility that VECF then allows the collaboratives at their local level to kind of have that Chinese menu of, we know early intervention is really critical in our area. But, so we as a local coalition have flexibility not only to advocate in support of VECF's appropriation, but, to look at state preschool funding or home visiting funding as well. And that, again, is a benefit and the flexibility that we're allowed as local coalitions to have that focus and move on those issues, not only at the state level, but another thing that we're very careful of remembering is local level. There are many local matches that are required at health department or local boards of supervisors that we work with. So our advocacy efforts focus not only at the state, but also at local city councils and boards of supervisors as well.
So you really think and work across the whole system?
Yes, we try.
Go ahead.
I have a question kind of along that lines, because that level of advocacy and planning and thinking about stuff, it requires a pretty sophisticated local leader or local kind of staffing stuff. What have you found to be the necessary there for for that kind of local staffing or the expectation of local leadership or local backbone organization to make this successful? Because a lot of this kind of rises and falls on the leadership at that local level.
Definitely. So Smart Beginnings Greater Richmond has, I was just kind of counting it up, since I started there in 2010, and at that point we had we had 4 full-time staff dedicated towards the systems work, which includes advocacy, public awareness, project management. I think is kind of an easy way to kind of describe a lot of the work we do with different providers. And those staff people were really focused on just those levers. That doesn't include the staff people that we had at the time doing our quality rating and improvement system, or groups of home visitors that were preparing niche applications or home visiting training that was shared. So really those 4 core staff people, which were at our coalition and were staff of United Way, really helped to move the needle on some of those pieces. My background is actually in communication. Another one of our staff that was key in our advocacy work, her background was communication and advocacy. So when you have that skill set layered on top of a partnership with the Greater Richmond Chamber with access to executive level leaders and other business champions who really have a different level of access with certain people, and I think one of the things that we found was our partnership with the business leaders. Legislators don't expect to hear a CEO of a power company talking about the importance of early childhood. So just the wow factor of making sure we have those unexpected partners delivering the messages. It's not just us in the choir, it's not just United Way, it's not just Human Service. We love babies, they're great, they're cute. But it's really cultivating those unexpected messengers to really carry that message. That has been a great win, and I know Kathy has played a tremendous role in that over her years in Richmond as well. But we had staffing that had background in communication and advocacy and were able to really help us get on the track of that. That is different than, again, that varies by each local coalition. And I think you can see different strengths and different opportunities based on the skill set you have working on your coalition.
And this is Kathy. I would just jump in and say that, as Jackie mentioned, there's really broad variability in the sophistication of that kind of skill across our 25 or so initiatives. And we have, at the foundation level, we have a paid lobbyist who assists us with our legislative strategy. I have a staff person who's brilliant in thinking about these types of strategies. And we really dedicate the technical assistance that we provide to the initiatives, to those community initiatives where the appropriators live. So we feel like we can't do it all, so we really target where we want to make sure we're providing support and services, and we're just really fortunate that Richmond, which houses many of our key appropriators, get to hear from Jackie and her friends.
So technical assistance around advocacy, you target to the communities where they're appropriators.
That's right.
And I would say that's true of a lot of places, that that you have the sophistication of someone like Jackie and her organization, but generally there isn't that level of sophistication in a lot of places across the state, and there is a need for technical assistance. But in providing that technical assistance around advocacy to community leaders, you're empowering them in so many ways across the whole system of work you're doing around young children. So it can be a powerful tool.
This is Deborah. I just kind of wanted to jump in and give a word of advice or caution, perhaps, because I think one of the journeys we've taken in our state is that we've had a wide range of expectations for our local community coordinators or directors or whoever's leading the local community initiative. And I said before the call, if we could roll back the clock, I think thinking about what is it that you want to accomplish with these local entities, and then build your staffing pattern around that, and think very carefully about the amount of resources that need to go into being able to support that. And we've so been trying to do this on a shoestring, and have really not been able to put the resources into our local initiatives that help them be able to do all of those things, get people to coordinate and improve collaboration, to do the advocacy, to help connect with families and help increase awareness. I mean, we have a pretty big charge and a lot of money, and we've even encouraged a lot of our local initiatives. Oklahoma has 77 counties, and some of them have said, well, for our, $70,000 a year, we'll try to cover 4 counties, and it's just not, we're really talking more about deep rather than wide, because to truly impact some change, we believe you have to go deep, and you have to maybe even look into communities, and you have to go to where some of the things that are getting in the way of kids being prepared for school might be in the greatest need. And because going wide, we just weren't quite sure what we could say were any of our outcomes. It was too big of an area and too much. So advocacy is certainly an important part of that, but I think you just, you almost have to pick your priorities and then build your staff around that and try to stick to what's going to best meet your needs in the state.
This is Nadine. I'd like just to jump in on the advocacy piece because we've approached it similarly, where we have somebody at staff level who's very sophisticated and working with the legislature. We have a hired lobbyist, but we also did a lot of training at the regional council levels and provided them toolkits. The individual regional councils can hire someone and use some of their funds to do community outreach, which some of them have done. And I think in a very tangible way, it really did pay off for us because in 2008, the legislature referred us back to the ballot to completely take all our money. And we, through really the fact that we were so embedded in local communities, that people were aware and saw how the money was used for children in their own communities. The regional councils made a point of broadening that awareness within their areas, and we defeated it by 70%, which was a huge vote of support, really, for First Things First. And it really, I will tell you, I really attribute that to the work of the regional councils.
So we are running out of time. This was only supposed to be an hour, and maybe if people can stay on a few more minutes, we'll keep going a few more minutes. But I guess for those who are going to have to go, if we could share some lessons learned from each of your states as to in advising Illinois, if you knew now what you knew then, what you know now, what would you have done differently, or what really worked that you're so glad you did? Maybe start with Virginia.
Well, let's see. I'm very glad to share now and in the future. If you have questions and want to talk, we've learned so much from other states, and then learned so much from our experience that we're very happy to share, and we'll share candidly what we have learned and mistakes that we've made. I think I have shared that we sort of have shifted a little bit our thinking about the model of funding and the real need for more consistent and sort of continuous funding. We have found over the years that it seems to be the funding to make sure that there's dedicated and high capacity staffing in each of our initiatives is really key. We had provided bigger dollars, but we saw that communities had the tendency to sort of start up programs and services with that funding that then couldn't be sustained. And we've really learned that a focus on the specific skill set of convening and sort of coordinating, orchestrating the local system is, really requires dedicated staffing and is really the key gift of this of our model. We've had some sort of fits and starts over the years. Sometimes some of our communities have gotten together and started an initiative and have gotten partway through and realized that they didn't have the right people at the table, or something about the formula wasn't quite right, and they've a few of them have sort of folded and then restarted in a different format. We noticed sort of a tendency toward more regional approach than having just like one region in our state had about 5 smallish Smart Beginnings of, clustering of about 2 counties each. And because they found that they were sort of tugging over resources in a very rural and low resource area, they realized that if they band together, that they could really save some cost and be more efficient and effective in the way they were kind of covering the region. So, these lessons that we've learned, I had one of our advisors said recently, and I have really carried this with me because I think it's such an important lesson, that the value of our learning curve is one of our best contributions to the state's system. And the things that we've kind of failed in or stumbled on actually bring so much value in terms of what we've learned and sort of directions that we can share with others, that it's a great way to sort of a nice positive perspective. But I think those are my would be my parting words for now, and I'm afraid I do need to go to another call, but wish everybody the best of luck and really glad to talk further in the future if it would be helpful.
Thanks, Kathy. Appreciate it.
Thank you, Jerry.
Deborah, you want to speak to Oklahoma's lessons learned?
Sure. For the majority of those, I think I'll just refer folks to our profile because it does have a lot of our lessons. But the thing that I think that I'd like to add to that is that because a number of the people that we have hired to be our local coordinators or directors typically come from an early childhood background, and the tendency begins to drift toward wanting to create more programs or to implement specific, literacy initiatives or and some things that are really almost direct service oriented. And the beauty of being able to be a neutral early childhood convener is that you don't have an agenda about a particular program, that you want to make sure that the best, most effective programs are in your community. So really don't create what we're trying to improve. Don't make it worse by creating more programs, but really try to stay focused on that coordination role. I think that's much needed, and I think until we're sure we're maximizing all of our resources and have our families with the best fit for the services and supports that they need, we don't need to be going out into communities and creating more programs, because nobody's doing that coordination.
Great. Thanks, Deborah. And Nadine for Arizona?
Well, I think for us, one of the really key issues is this constant balance between local decision-making and having enough, choosing the kinds of strategies that give us the rolls up to enough significant work on behalf of children so that all kids really are ready to be successful and when they start school. So it's a very complex dance, but I think I would just say one that is very well worth it. I do think that local efforts do need to be staffed. These are volunteer people, and I don't think that this can work very successfully on their behalf if they're not staffed, if you don't have ongoing training, if you don't have opportunities where you convene several times a year with staff and board members and regional councils. We do regional forums. We're actually doing that this spring where we meet with all regions and at least 2 board members are present. We have very informal dialogues, what's working, what isn't working. We do a statewide conference every year where we, again, try to have dialogue. We bring in our chairs and our vice chairs and do training and leadership training. We try to keep the door of communications open and very strong. I think also very key for us is the need to respect diversity. One of the things that a lot of people have noticed about the state of Arizona is really how far we've made progress with our tribal partners, but that's because we've respected their position as sovereign nations. And when you look at pockets of poverty, they're very much concentrated in these areas, so it's very important that we have strong relationships there. And then I would tell you that everything just has to be accountable. Everyone needs to be accountable and for outcomes for children, and that needs to be data-driven. And we have worked really hard to move along that line and benchmarking the work that we're doing. And the regional partnerships are very much engaged with all of that. We really see ourselves as one, not a separate entity of regional councils and a state board, but that we have to be one mechanism working together.
Thanks, Nadine. That's great. Any last-minute questions from participants before we close? And I apologize that we've run out of time. There's just too much information and too much to discuss, but this is just the first conversation, I will emphasize. Well, if anyone wants to follow up to get more information, as I said, the state profiles we sent have that information. We'll be also posting to the BUILD website and to Illinois' website as well if they're interested, the other state profiles that are done as part of this research. And so there's a lot of information in there. And then I'm also happy to connect you with any of these states to talk further. So this is a continuing conversation, and BUILD is committed to supporting Illinois through this process. So we appreciate, thank you so much to our speakers for being on today and sharing the work in their states, and to all of you in Illinois and the great work that you're doing.
Thank you so much.
Thank you. Thank you.
Thanks, Jerry.
Thank you.